vitals on presentation were stable on room air. On physical exam, neuro exam, cranial nerves 1 to 12 were intact. No focal deficits were noted. Labs on CBC white count is 8, hemoglobin of 14. On CMP, sodium is 130, otherwise other electrolytes, and LFTs were normal. Normal sensation, head to toe in all areas tested. Normal coordination test. Romberg test is also negative. No pronator drift. Normal heart, lungs, and abdomen. Patient says her symptoms have been intermittent over the last few days. And by the time patient arrived in the emergency department, symptoms are kind of improving or getting better. And CT of head or CTA of brain is ordered, and it's also unremarkable. So patient was admitted for further management. An echo was with bubble studies done, and that's also normal. EKG did not show any acute findings. So neurology was consulted, and this patient was placed on dual antiplatelet therapy with aspirin and Plavix, and MRI is ordered and is pending. So given patient's risk factors and history and physical exam and all objective data with labs, imaging, and everything, vitals, this is the most likely diagnosis. If this is acute infarction, if this is acute intracranial process, where is the area of infarction or lesion? If I give you multiple choice, A, right MCA infarction, B, left anterior cerebral artery or ACA infarction, C, left lacunar infarct in the left thalamus, D, acute lacunar infarct on the right thalamus. Choice E, right PCA infarct or lesion. So what's the correct answer? And the second question is, what's the disease progression, typical disease or progression for this condition, for this type of pathology? What are the complications? What are the things to watch for once this acute phase passes? And what sort of treatment or rehab does this patient need? Yeah, so those are some of the questions